Hey guys, Eric Christensen from Chandler Physical Therapy here. Wanted to talk a little bit today about dizziness and vertigo, the differences between the two, as well as some things you might see and the systems incorporated with these specific diseases. As always, as I get through this, if you do have any questions, comments, or concerns, please feel free to contact us at 480-786-4969 or at chandlerpt.net. I think the important thing to understand first is that there are three sources of information for balance in the body. The first one, obviously, is the eyes. We are very visual creatures. We get a lot of our information about the world around us from our vision, as far as orientation to vertical, things moving, shadows, those sorts of things. It's very important to us, and we tend to be very visually dominant. So when things go wrong with the eyes, we tend to see issues related to balance because of that. Um, Always there is the inner ear. That's the pretty classic sign where someone gets the crystal knocked loose in the inner ear and they get significant spinning and vertigo related to it. The inner ear is kind of the trump system for all three different systems that bring in balance information, so that if there is a conflict, the body looks to the inner ear to basically say, okay, which one's correct. And then the last one is proprioception, which I misspelled, and it is joint position in space. So basically, if you close your eyes and you bend your right elbow to one set degree, how do you know how far to bend your left elbow to match that? And that is basically that proprioceptive sense. The muscles are basically the relayers of this information. They send it in through something called muscle spindle and Golgi tendon organs, which give us information as far as acceleration of muscle lengthening or contraction, tension about it, and overall position in space. And when things go wrong with that, again, the information for balance is altered. So really, what can go wrong? With the eyes, a lot. You could lose visual acuity as an inability to see where you may need some corrective lenses. Obviously, if you're not getting the information in correctly, you're going to have issues related to that. Um, the big one that I see in the clinic that is not diagnosed is visual tracking. And you'll have folks that go in and be like, I just had my eye exam, my eyes are fine. And maybe from an acuity standpoint, maybe they have 20/20 perfect vision. But when you look how well they're tracking left to right an object that is moving, it's significantly poor. And when you are following an object, your vision should track it smooth. And what tends to happen in folks that have poor visual tracking is they jump, and it's something they call saccadic pursuit, as SACCIDIC pursuit. And basically, they're trying to guess where that object is going to be instead of following it smoothly. They're jumping to where they think it's going to be. And if that object is there, great. But if it's not, they're going to violently look around until they find it, which that creates a mismatch of expectation of where an object is versus where it actually is, and can create dizziness or imbalance. As far as the ears, lots of things can go wrong with the inner ears. This is just some of the main ones that you'll see. BPPV stands for benign paroxysmal positional vertigo, and it's probably the leading diagnosis of vertigo that I get to see in the clinic. Basically, in the inner ear, there are hair cells, and those get pushed left or right, and those hair cells are weighted by calcium crystals, and those calcium crystals can break loose and roll around the inner ear, and that rolling stimulates the inner ear and gives the ear the perception that you're moving when you're not. This creates significant spinning because the eye tracking mechanism is a reflex. And so when the inner is stimulated, the eyes track as if you were turning, and it can give you the illusion of spinning. Meniere's disease is basically an alteration of fluid pressure, what is thought to be fluid pressure in the inner ear. This is a more chronic type vertigo, and you'll see it kind of come and go over time, and it can be managed, but to my knowledge, they don't have any set cure for Meniere's disease. And then vestibular neuritis is something that when we're looking, say you have a head cold, your sinus cavity gets infected possibly. It can also infect the inner ear, which creates, again, an issue with pressure and excess fluid. which can create vertigo. This tends to be a little bit more transient. Once the infection has calmed down, that fluid goes away, you see normalization of symptoms. And what can go wrong with proprioception? Lots and lots of things. And honestly, I think this is one that's underdiagnosed a lot. People lose the ability to perceive where their joints are at in space well, especially as we age, and can cause significant issues with balance that they don't realize until an injury occurs. Nerve impairment. So obviously, if you're not getting correct information back from the system, you're going to have an issue processing that information. So that could be something like a diabetes, or perhaps a chemical issue with the nerves from some sort of cancer treatment or radiation treatment. Prior injury. When we get an injury, we lose the ability to perceive that joint and where it's at in space. The muscles around it are altered in function. And if you rehab it properly and kind of retrain it, you'll gain that motor control back, that awareness back. But it's not a guaranteed thing. It does need to take some attention. Arthritis. The joint is damaged, and therefore the joint structure and your ability to perceive pressures in that joint will change, as well as muscular function around the joint. You tend to use the joint less and less because of pain, and that can also alter the feedback from the muscles to the brain, and things change in that regard. And then surgery. Surgery is like an injury, basically, just a very calculated injury, and swelling that is present, the pain, the disuse, the muscle atrophy, all those things lead to a deficit in proprioception. So with vertigo, and this is the big classical definition, is that vertigo involves a spinning component. If you don't feel like the world is spinning around you, then you likely don't necessarily have true vertigo. You could have dizziness, which a lot of people will just casually call vertigo, but technically it's a misnomer. If you have true dizziness, you're going to feel imbalanced, drunk, like you're floating, like you just don't feel quite connected to the world or your bodies. I get a lot of my head's disconnected from my body. And that comes from a mismatch of all three systems coming together. So your eyes see one thing. If you have poor visual tracking, what you expect to see and what you're actually seeing are two different things, and that can create a mismatch. We can add that to a poor proprioception, so you don't necessarily know where your ankle joint is at in space as well as you should, and you're reliant on your vision. And say you suddenly have some issues with visual tracking, then you have two systems that aren't reporting correctly. And so your eyes say one thing, your ankle says another, and your inner ear says yet another thing. And that big conflict there, we have major issues with. And that's what I see a lot of patients in the clinic about. They have three systems that are telling them three different things, and they're not quite sure what to trust. And so they kind of bounce back and forth with information for all of them, trying to find some sort of central point of balance. And they feel sick. Sometimes they can get headaches because the muscles around the neck are desperately clinging to try and stabilize the head because there's a perception of imbalance or that the head is possibly moving. And so you'll see the muscles around the neck spasm to control this perceived spinning. A lot of the muscles on the neck are big headache referral symptoms. And a lot of times if we reestablish kind of or calibrate the inner ear, we see headaches go down. Fatigue, you'll see that a lot of times when you are desperately trying to find out where you're at in space, it taxes the body. Your eyes get tired. You're using more than you're normal. You're hypervigilant to try and make sure that you're not going to fall, and that can cause some serious issues. Coupled with that, you'll have some emotional issues. Maybe you're removing yourself from social situations because of fear of falling or fear of injury or just particular fear of embarrassment. Sometimes this comes with severe nausea, vomiting, and that can remove you from social situations as well. Physical therapy is crucial to get these people back to the basics. And really, when you're looking at this, a proper exam is going to really direct our treatment. A good in-depth exam will tell you exactly where your deficits are, and that treatment based off that exam will vary widely. For the inner ear, say that BPPV, you're going to do what they call a cannulate repositioning maneuver and literally try and get that crystal back home so it can be reabsorbed so it doesn't disturb the inner ear. Something for visual tracking, we'll give specific exercises to retrain visual tracking. And proprioception, we're going to work on varying balance situations with differing surfaces to challenge different aspects of balance. And the good news here is that a lot of people, if you come in, you do your work and you're doing your homework, improvement is fast and it stays good. And they improve significantly, and you don't see a lot of recurrent issues with this outside of possibly that Meniere's where pressure changes in the ear and you get flared up again. And always, if you do have questions, it's easier to treat the newer it is. Your body has less time to adapt, and you can process these things, and you can rehab this much quicker. If it's been a long time, it's obviously going to take a little longer to return back to normal. If you do have questions for me, please don't hesitate to call 480-786-4969. You can find us at chandlerpt.net or at info@chandlerpt.net is our email address. So feel free to contact us if you have questions. Thanks, guys.